I'd like to talk to you today about neurofunctional pain management for the treatment of peripheral neuropathy. Neuropathy is probably one of the most common conditions that people come to us looking for treatment for. We have patients, thousands of patients from all over the country looking for treatment options for that condition. Surprisingly, neuropathy is a very difficult pain condition to treat. I've talked to a lot of pain doctors, hundreds of pain doctors over the years, and primary care doctors as well. And all of them are dealing with peripheral neuropathy as a major problem. In a lot of these cases, it's diabetic peripheral neuropathy. And if you have this condition for years, the the symptomology or the progression of symptoms just gets worse and worse. It starts out with numbness and tingling and pain, and then it actually goes, keeps moving further and further, and becomes more of a problem. And after a couple of decades of dealing with this, patients often don't have many options. And so that's where patients and people are looking for treatment options for this, something that'll actually work. And a lot of doctors just don't have good options. I mean, again, I've talked to a lot of doctors, and their primary method of treatment is prescription for just the pain condition. And that will wear off after a while. They're starting out with some non-opiate pain prescriptions for this, and there's a number of different medications that they start with and run with, and they do eventually wear off. And a lot of patients have experienced that. They're still in pain decades into this neuropathy process, and those medications just stop working. So patients reaching out for neuropathy, what I want to do is talk to you about how neurofunctional pain management actually treats the pain and helps get rid of the pain associated with this neuropathy condition, right? So neurofunctional pain management, it is a combination therapy. It uses high pulse electroanalgesic treatment and IV hydration therapy and health coaching. All right. So let's start with the electroanalgesic therapy. So electroanalgesia is an FDA cleared category of electrical therapy. It is not the same thing as a TENS unit. A lot of people are experiencing TENS units in different capacities. They go to different offices and they get put on a machine that is supposed to help, and it's a TENS unit most of the time. That's a very different type of machine from electroanalgesia. They look very similar and they may even feel similar, but there's a difference. I like to use a comparison of light. Everyone knows the difference between ultraviolet light and infrared. They are actually basically the same thing. They just have a different wavelength, and they impact matter very differently. I mean, if you shine ultraviolet on something and infrared on something, those materials react very differently. So that is a good way to think about how a TENS unit and an electroanalgesic therapy, how they're different. So a TENS unit is a lower pulse per second. The FDA classifies these devices by how fast they pulse the electrical current. So a TENS unit goes up to about 450 pulses per second, and that's basically a TENS unit. It can treat muscle tissues and things like that, and it helps in some cases. Electroanalgesic therapy goes up into thousands of pulses per second, and the device we use goes up to 10,000 pulses per second. And that pulse per second range, that creates a very different effect on the tissue. It has the ability to stimulate nerve tissue specifically, right? And also stimulate vascular tissue. What it's doing is stimulating the some of the finer, denser tissues in the vasculature, in the actual capillaries and vessels and all those things in those tissues. So the stimulation of the neurons, that's probably the most, I guess, impactful aspect of electroanalgesic therapy. The electrical currents are hitting that neuron so fast that it can't repolarize. It's called depolarization, and it depolarizes the neuron, and in the process, it's stimulating that neuron. There's a lot of great, there's lots of biopsies out there showing that you can basically reactivate old and kind of decayed or dying neurons in the tissue that have basically lost their ability to function over time due to lack of blood flow and nutrients, things like that, associated with like a diabetic neuropathy condition. Right. So if you stimulate those nerves and you stimulate the blood flow in that area, everything starts to wake back up and everything starts to act normal again. So one of the aspects of, the pain relief aspect of the electroanalgesic therapy is that it is stimulating these neurons and creating depolarization. Depolarization is where you prevent the pain signal to the brain, which will then in turn stop the inflammation cycle or slow it down, right? So you're going to slow down that pain inflammation process, and it gives the tissues a chance to heal without all the constant pain and inflammation cycle. So in doing that, these tissues are being stimulated. The vascular tissues are also being stimulated. You can actually re-stimulate and agitate those cells in that tissue to actually to regenerate, if you will, and heal. We don't use the word regenerate in the treatment model, but you do actually use it to revitalize those tissues. One of the most common effects that occurs when someone is being treated with electroanalgesic therapy for a neuropathy condition for the pain aspect is that they'll go, if they don't have any sensation in their say, let's use lower extremities in their feet, they don't have any sensation because of years and years of neuropathy. And then after 3 or 4 treatments, or maybe a couple of weeks into the program, they start to experience pain again. And they say, oh, my feet, my legs are hurting again. Previously they were just numb. Now they're hurting. That's actually part of the healing process, part of the nerves turning back on. Everything's coming back on. It's coming back online, if you will. And there'll be a short period where there's some pain that's being reported because everything's able to report again. And so, but then after that, it goes back into normal. And, we've had literally hundreds, maybe even thousands of patients who've experienced that cycle of, I don't feel anything at all, to, oh, it's starting to hurt again. Well, that's a good sign, right? They don't think of it as a good sign, but it's actually a good sign. And then it goes back to, I can feel everything, but now I don't have pain. And that's where we want to get them to is over that point. And so once they're in that state of, I can feel things again, but I'm not in pain, that's a great sign. So the treatment program itself, the actual neurofunctional pain management model, it's an 8-week treatment program that has 2 treatments a week for the 8-week duration. Neuropathy is actually sometimes pretty severe. We keep the standard treatment to 8 weeks, though some people with very difficult neuropathy cases may actually need a longer period of time. We'll talk about that when we actually talk with you on the phone or get you set up as a patient in our system. Meet with one of the doctors we work with and get you in the program. They may end up creating a longer treatment plan or do an 8-week program and then extend it to continue to obtain the benefits as long as needed because it's working, right? So, but for most pain conditions in most scenarios, we just stick to this 8-week model as a standard model to get the patient going in the program. So the electroanalgesic therapy is effective if it is done in a sequence over time. So 2 treatments a week, and then do that for 8 weeks. And then the outcome of doing that is that you've created this depolarization effect that continues to endure longer and longer and longer. So with each treatment and each addition into each week of treatment adds to the total duration of how long this treatment will act afterwards, how long the effect will occur afterwards. The average patient that finishes the 8-week program is expected to encounter 3 to 6 months of continued outcome, continued pain relief. If you got from, say an 8 down to a 2 on your pain scale, we expect that to last for 3 to 6 months. Most patients get several months of pain relief before it maybe starts coming back. Now, this treatment program is treating pain, and I like to point that out to people. We are not curing any sort of underlying condition. If your neuropathy pain is caused by diabetic condition, we're not treating the diabetic condition. We're not trying to do that. That's not our work, not our job. And I still believe that that's something that doctors really, really are aiming to do in the future. And I know that they're after that. But right now, what we're doing is just treating the pain associated with neuropathy so you can get your life back and get back into action and doing things again. So that's the objective, is to try and get you out of pain. And then once you're out of pain, you're more likely to be able to walk around and to get more exercise and to be more active. You're probably going to be more motivated to eat better, and you're going to get better sleep. And all these great things are going to come from just getting out of pain. So that's why we start there. We'll start with getting you out of pain, and then we can work on all the other health benefits. So the second component of neurofunctional pain management is the IV therapy. So we have a vitamin mineral IV mix. Most chronic pain patients are in a state of nutritional deficiency. Now, a lot of people will think, well, nutritional deficiency, I get plenty of food. We're talking about a vitamin mineral deficiency. There's a number of very useful minerals that a lot of people just don't get enough of. And when they actually get an infusion with these vitamins and minerals, it can really assist in the pain relief effort. Matter of fact, I know doctors, and I know some medical offices where they have pain treatment programs that are only IV therapies, because they just have these really unique blends that they give the patients for pain, and it can work, you know. But in our case, to keep everything covered by Medicare and commercial payers, we stick to our electroanalgesia based treatment protocol, and the IV therapy is a part of that. It's assisting in that treatment model, and we are assisting the patient with nutritional deficiency in that model as well. And that's part of how the whole program is reimbursed and covered. All right. So the other component of that IV is the hydration aspect. Patients need to be hydrated, and a lot of chronic pain patients are chronically dehydrated. Everyone knows that dehydration actually can induce pain on its own. You know, a totally healthy person can be dehydrated and end up going into states of pain just because of that. If you have a chronic pain condition already that you're managing, dehydration can actually spur and spark, flare-ups of that pain. So dehydration is really important. Another aspect of this is that the electrical therapy is relieving the inflammation in that tissue and dispersing those inflammatory markers out of that region. And to do that more effectively, you need good hydration. So that IV really does help. So each week, you would be getting 2 treatment events for an hour. One of those treatment events is electrical only. The other treatment event is going to be electrical with IV combined, assuming that you can actually take the IV. Some patients may have some health conditions or things like that where they aren't able to do the IVs. We understand that. You can still do the electrical therapy even if you're not eligible for the IV therapies, and the electrical will still work. It's just that the IV does enhance the effect of the overall program. We've noticed this over the years. If a patient were going to achieve success from an 8 down to a 4, with just the electrical, it might be 8 down to a 2 if they included the IVs in it along the way. And that it might be the case that they achieved pain relief with electrical only within 4 weeks, but they achieved pain relief with electrical IV combined within the first week or 2 weeks. So the IV will help speed up the relief process. It helps the degree of the relief that occurs, the outcome. It also impacts the duration afterwards. So if you are able to get into a better state of pain relief, you can actually really assist in how long it lasts as well. Again, we're aiming for 3 to 6 months of outcome for this. In the neurofunctional pain management cycle, the doctors we've worked with over the years have kept what would be called anecdotal evidence of their offices. And we ask them all the time, what do you think is the success rate of this treatment program with all the patients being treated? Sometimes there are hundreds of patients being treated in these programs through a single office. And the average so far from all the doctors we've talked to has been probably about 85%. So they'll tell us 85% of the patients we treat are achieving a greater than 50% reduction in pain. 30 to 40% of all the patients we treat are getting entirely out of pain all the way. So those are great stats, right? Great stats to have. I'm very proud to be able to just tell people, yeah, there's a 30 to 40% of people that come to the office are gonna walk out after 8 weeks being entirely pain-free. Some people, it will be relatively pain-free, and then some people probably won't have very much of an outcome. And that's an unfortunate aspect of everyone just being different. We don't know for sure exactly who's going to be very responsive. Some people are very responsive to the program. You do 1 or 2 treatments and they're completely out of pain and they're excited and amazed. And you do need to keep going, even if you do get out of pain in the first week. But they're completely out of pain. They're excited. And then some people will treat them for 4 and 5 and 6 weeks, and they're still not getting much of an effect. It does happen that occasionally someone who's not very responsive to the treatment just needs more time. I talked to one doctor who said a number of patients that he had worked with, they didn't really turn a corner till somewhere between week 4 and week 6, and suddenly, oh, it just all hit, and then all the relief occurred, and they're out of pain. And he said sometimes it just takes a few weeks for your body to respond because it's trying to keep things regulated, and right now it's regulated in a negative setting. So you're doing something positive, and it's trying to resist that, and it just takes weeks for your body to give in and experience that success of the treatment. So with neuropathy specifically, which is what we're talking about here, the doctors I've talked to, it's higher than 85%. They would all agree that it's probably somewhere in the 90s. That 90% of people or more that are coming into the office with neuropathy pain are achieving a greater than 50% reduction in neuropathy pain. So that's actually a very exciting stat for us as well. A few other pain conditions we have that we treat will actually kind of have some of those same numbers. But neuropathy specifically, we have a great track record of that. So I encourage anyone with neuropathy to consider this therapy option, neurofunctional pain management, as a potential treatment for your neuropathy. So the last component of neurofunctional pain management is the health coaching component. Health coaching, we break this up into 16 very short health coaching events. The nurse or the technician that's working with you is going to work with you on some goals and keep track with you, and they're going to see you twice a week. So they're going to help you try and achieve some outcomes here for your personal health. All right, so that's a component of it. A lot of people love this, like they love the health coaching aspect. Some people think, I don't really need coaching, right? Well, maybe you don't really need coaching, but it certainly helps to have someone to talk to about it and to have those goals and to work toward an objective. And also consider, if you are getting out of pain for the first time in a very long time doing this, it might be worth taking some additional effort to continue other health initiatives, eating better, getting more exercise, doing more things, right? All those things are going to be advantages for you in getting out of pain and staying out of pain. So we encourage everyone to take advantage of the health coaching component. And that is also a covered aspect of the program. Medicare does cover the health coaching component. Some of the other commercial insurances may not. So we'll figure that out when we talk to you. So how do you get started in our program? Well, our company, Relative, is we are an ancillary service company. So what we do is we work with doctors' offices to provide this treatment. Our company has all the nurses and technicians trained, and the equipment and the supplies, everything that we need to do this program. We take care of that, but we do it through doctors' offices. So if you are a patient at a doctor's office and you want this treatment, tell them, I want neurofunctional pain management. There's a company called Relative that offers it, and they'll do it through your office. Sounds great. We can actually set up an arrangement with that doctor, and we can get them started to get their practice going on this. If they don't want to work with us formally, that's fine. We can still work with you, and we'll just connect you with one of the other doctors that we work with, and you can actually have your insurance billed through their office. All right, so there's always a way to make this happen. We're a mobile program, so we come to your house and treat you at your own home. You don't have to make 16 trips into the doctor's office to get this treatment program. We'll actually come out to you and do it. So that's also a very exciting part of this. You don't have to drive around and travel around. I've seen patients, because they do get out of pain and they're motivated, I've seen patients drive an hour each way to get their treatment twice a week. That's another reason why we wanted to really get to, convert the whole operation into a mobile treatment model, because really half the patients that need this can't really get into the office. especially twice a week. It really cuts in. If you are not very mobile yourself, and you're not, it's called ambulatory in the medical field. If you're not very ambulatory, you can't get around, then it's difficult to get in and out to these offices. All right. So, uh, you know, uh, couple more things I want to talk about. One of them is you might be presented with a similar program by another provider, another doctor. There are other people out there offering something kind of like this. I will tell you pointedly, they almost always are not the same thing. I would say almost really only ever encountered a couple of other offices doing something similar to this, similar enough to where I would say, yeah, you're doing what we're doing, right? It's so rare to actually have a neurofunctional pain management treatment model. Um, Problem number one with that is that if you're not using the proper device, the actual electroanalgesic device, then you are not performing neurofunctional pain management if you're a provider. Your doctor might say, oh, I got the same thing. What they're really saying is, I'd like to keep you in my office instead of you going over there. That's what they're saying when they say, we have the same thing, or we have probably about the same thing. Just come over here and I'll treat you. Oh, you want that kind of treatment? Oh, come over here and we'll take care of you over here with something similar. What they have is not the same thing. And there's a big difference between a TENS unit and an electroanalgesic system, as I've already described. Remember, this treatment actually electroanalgesia directly impacts nerves, neurons, and those different densities of tissues. TENS units, they actually work great for muscles and things like that, but that's what they do. If they have a quote unquote similar device, if it's just a TENS unit, you aren't going to get the same outcome as you are with neurofunctional pain management, right? And most of those doctors are also not engaging in the IV therapy, which is very beneficial for the program as well. And then the actual last issue with we have a similar or same program is that they probably aren't able to actually get reimbursement for it. If you don't have the right equipment, you can't really get reimbursement. And that's one of the biggest problems. Doctors all over the country are sold equipment that can help with things like this. And really, some of this equipment can actually probably help. It's not going to be the same thing, but it definitely isn't going to be billable. You aren't going to be able to bill for this unless you have the proper equipment and it's been through the proper trials. And our equipment, it's been FDA cleared, gone through trials 35, 40 years ago, and it's been in the market ever since. Hundreds of doctors around the country have the exact same device that we use and been billing for treatments for decades doing this. So they know that it can be covered properly if you have the right equipment. And that's problem number one. Most of the other doctors out there that say I have the same thing don't have the same equipment, and therefore they do not have the same thing. But you as a patient, now you will know that there's a major difference between this device as a TENS unit and this device as an electroanalgesic treatment device. Unfortunately, if you were to ask that doctor, the one who says they have the same thing, what's the difference between this and this? First off, I've experienced probably 98, 99% of all the doctors and different types of doctors out there. If you were to ask that question, they probably couldn't actually tell you the true difference, the actual pulse rate differences, the effect on the tissues. They probably had never read a research article on this therapy or ever actually read a research article on electrical therapies, and most of them haven't. They've used the devices in their office and they know what they can do because a sales rep or a company gave them some literature and said do this and do this and it'll help a patient. That's about what they have, and that's not because they can't understand it. It's just because they don't have time to deal with it. This is probably one device out of 100 or out of a dozen things that they're doing in their office. They don't have time to figure out why this is different from something that they don't even have. Also, too, you have to know that it exists before you can even know the difference. If you don't know that this is truly something different from this, and you don't even know that electroanalgesia exists, then how could you possibly explain the difference between the two? All right, you can't. But most doctors out there claiming, oh, I can treat you for neuropathy. I've got a thing over here, right? It's not the same. It's just not. And if they don't know and if they can't tell you the difference between those two, they certainly don't know that what they have is actually the same thing as ours, and they don't. So that being said, if you are looking for a genuine treatment for your pain condition, something that will work, that is non-pharmaceutical, non-surgical, non-invasive, safe, effective, 85% success rate in getting out of pain, 3 to 6 months of duration after you complete the program, right? That's what neurofunctional pain management is. That's what we do. We would love to work with you. We would love to talk to you about it, explain it more. I encourage you to reach out to us. We have such a strong success rate with peripheral neuropathy that we're extremely confident in this treatment model for that condition, for that pain aspect. We encourage you to reach out to us, see if we have a technician or a nurse near you. We can actually get you into our mobile program. I want to leave you with one quick story of a patient that we had years ago. Her name was Gail, and she had an extremely difficult lower extremity peripheral neuropathy condition. Been induced, she'd had it for probably 20 years, right? She was working with a neurologist. She'd been working with that neurologist for 15 plus years. She'd been on medications. That's all that they had ever done for her, was just cycling different medications. She found us and she asked her neurologist if she could go do the program. And that's the one thing I point out in that story, is a lot of patients will go ask their other doctor if they can do it. That's when that other doctor, would try and offer them something else, or say, no, I want to keep you as a patient. I don't want to send you somewhere else if I don't know what that is, or if I don't think that it's going to be useful, right? Her neurologist was great. And he said, sure, go for it. If it's not pharmaceutical, then I think if anything at all helps you, that's great. Go for it. So she came in, and it 4-post walker, and it took people helping her to get her into her chair for treatment. About halfway through the program, she was walking around the office with a single post walker, no 4-post walker, no help getting in and out of chairs. Perfectly fine, just a single post. By the end of the program, she was walking around with no cane, no walker, walking around, and she danced a little jig in the middle of the room for everyone there to show everyone what she had accomplished, what can happen if you stick to this program and do this. So she's one of my favorite stories to talk about, because she got her entire life back. And before that, she was practically chair bound, or, unable to do anything, unable to go anywhere, go for walks, anything like that. Now she could get up and go wherever she wanted. She could walk around. She could do walks outside. She could spend time with friends and family. The cool part of the end of the story is that about 4 months later, she shows back up in the office to show everybody her brand new driver's license that she hadn't had in 20 years. And now she's got it back because she can feel her legs. She's out of pain, and she's walking around without any assistance, and she got her driver's license back. She literally relieved pain, restored health, and magnified quality of life. It's the mission and the motto of our company is to relieve pain, restore health, and magnify quality of life. And she accomplished that trifecta of outcome. So happy that happened to her. And she's one of hundreds and hundreds of patients who have gotten their life back from getting out of pain and doing this program. So I highly encourage you to reach out and talk to us, try and get this treatment into your life, get it scheduled. It is covered by Medicare and commercial payers, should not be a problem to get you treatment coverage for your insurance, right? Reach out, give us a call. We're happy to talk to you. I look forward to working with you. Thank you so much.